Welcome everybody to Gender Equity and COVID-19, a local lens on a global pandemic. Thank you so much for joining us this morning. We are really excited for this conversation. My name is Sarah Giorsi, and I'm the Executive Director of NewMexicoWomen.Org, which is a statewide women's fund that works to advance opportunities for self-identifying women and girls so that they can lead healthy, self-sufficient, and empowered lives. I want to thank Native Women Lead and Jamie Glochet for joining us today and partnering with us on this webinar, and also to the Santa Fe New Mexican for broadcasting it wide and far. We're so glad to have you on. I also wanted to let you know we'll be recording this webinar, and so you can access it on our website and on our Facebook pages later, and that we will also be transcribing it into Spanish for accessibility reasons, so that will be available as well. If you have questions during the webinar, there's a link on the bottom of your screen where you can submit a question, and toward the end we'll be fielding those questions with the panelists, so feel free to submit a question. So NewMexicoWomen.Org is a statewide organization, and we're based in Santa Fe, which is Tewa land, and I just want to acknowledge that we are guests on this land, and I want to acknowledge the history of this land and all the original peoples of New Mexico and of the United States. The topic of today's conversation is about COVID-19 and gender equity. And as we have seen COVID-19 exacerbating the inequities that have existed prior to the pandemic, we know that self-identified women and girls, as well as tribal communities and communities of color throughout the state, have been disproportionately impacted. We've seen increases in domestic violence cases and threats to women's health and reproductive rights. And we know that women, particularly women of color, are on the front lines serving as essential workers. So today's conversation looks at these issues from a gender equity perspective, and it takes into account the numerous intersections of identity, such as one's race, one's sexual identity, one's status as an immigrant, one's class, and it looks at these issues through the lens of these various identities, because we know that these factors will shape and inform how an individual or a given community is impacted by this pandemic. So our panelists are going to share the challenges that their communities are facing during this time, along with the ways in which their organizations or communities have had to adapt, because the name of the game right now is adaptation, and we want to know how our community is adapting. And then we're going to explore what this moment is calling forth. What is the future? What will happen beyond this pandemic, and what opportunities are being presented to us who work for social change by this pandemic? So we also want to bring to your attention 2 emergency relief funds. The NewMexicoWomen.Org has begun the Gender Equity Emergency Fund, and it is supporting the immediate needs of women and girls and organizations that work with self-identifying women and girls around the state. And you can learn more about that on our website, and that information is also running along your screen. And Native Women Lead has the Matriarch Response Loan Fund. So we really want to ask you to consider making a donation to those 2 relief funds, because we know that the need for immediate assistance will go beyond just this moment. And as we look ahead, we'll need to respond to the needs of the communities throughout the year. So please consider that. So now I'd like to introduce you to our panelists today. So we have with us Jamie Glochet, who's the co-founder of Native Women Lead and the project manager at Roan Horse Consulting. We also have Dr. Patricia Trujillo, who's the director of equity and diversity and associate professor of English and Chicana studies at Northern New Mexico College. She also is a board member for NewMexicoWomen.Org. Sarah Silva, who's a certified professional coach for the PICO National Network and a board member of NewMexicoWomen.Org, will be joining us later in the webinar, so we look forward to having her voice. She's located in Las Cruces, New Mexico. And we have Fatima Van Hattem, the program co-director of NewMexicoWomen.Org, along with Renee Villarreal, the other program coordinator for NewMexicoWomen.Org. Welcome, everybody. So we're going to start with our first question. And Jamie, let's start with you. What challenges is your community experiencing during this crisis, and how have you had to adapt to meet those challenges?
Thank you. Well, really, it's been devastating, disrupting. As you mentioned before, disproportionately, we've been affected just based on just what I was looking at with the Department of Health website. Native Americans represent at least 56% of cases with COVID. And it's something that's very, I think, real in our communities. And when we look back at history of colonization as well as introduction to disease and virus, it's really scary because at contact, our populations were decimated by about 90%. So there's definitely that. And then mobilization in communities that in tribal communities and urban spaces is definitely, there's an urgent call to respond. I just recently read an article that pointed out like the basic overall well-being and health of Indigenous communities, access to wealth, and even access to water is one of the key things that are very challenging for all of us to respond in light of all of this. So it's detrimental. With the Native Women Lead work, we did a survey with partner organizations to understand like what the impact is with respect to small business owners. We surveyed over 100 representing 40 different nations. COVID, they said that COVID would affect their business anywhere from 80 to 100%. As a result of this, a lot of businesses operate both on tribal lands and off tribal lands, are definitely dependent on like in-person sales. And I think of the whole creative economy that exists in New Mexico. So what's happening and with respect to our communities in the economic sense is that financial stability is being is definitely being undermined right now. And with women, particularly with the Native Women Lead, you know, we saw that Native women are the primary economic stabilizers, and that's really the case in a lot of women of color spaces. So losing a job, losing income, losing your small business really affects the economic stability and then makes our communities that much more vulnerable as a result. So I think for us, for Native Women Lead as a small organization, we've pivoted to, we had our in-person retreat, so now we're pivoting to virtual webinar series, but we've also been working on this access to capital issue, which has also been exacerbated as a result of COVID. So we're launching our co-op capital fund, which is not based on collateral or credit, to really support entrepreneurs just to at least survive for the next couple of months. And then we'll be launching grant funds as well, and then supports to really provide wraparound service support.
So the Access Capital is the Matriarchal Response Loan Fund.
That's correct.
Great, excellent. Patricia, let's hear from you about challenges and adaptation. You're muted. We can't hear you. You're muted.
Technology. I was just saying, buenos dias, le de Dios. It's really wonderful to be here and be a part of this panel this morning, especially considering the issue of having a gender equity response to the COVID-19 pandemic. Before I get started on the challenges, I just want to recognize that something that I've really been feeling is that I'm very grateful to the grandmother knowledge in my life. For like the last few days, I've been thinking a lot about my grandma Lola, my grandma Pepa, my great grandmothers, Marina and Celia from El Prado. And so much of the knowledge that we're calling on right now is really, you know, what they've taught us, our mother knowledge too, my mom Elaine, my sister Bernadette, and like when we're in these hard situations, you know, usually smaller at home crises kind of things, what does it mean for women to spring to action? And so for me, I've also been really, really thankful and have a lot of gratitude for the fact that we are being led by a highly competent and very caring Latina governor with Michelle Lujan Grisham. I've had friends from all over the country reach out and say, like, you all are so fortunate right now to have this leader who is doing such a great job, not just carrying out like the policy and making the adjustments that are needed, but also like having a leader to care and say, like, we're so sad and we're so sorry for the people who are suffering, for the citizens that we've lost, and that this is something that we truly are all going through together. And so it just, for me, it reminds me to ground myself in women of color theory. I've been rereading this bridge called My Back, writings by radical women of color. That was edited by Gloria Anzaldúa and Sherry Moraga, because there's this concept right now that so many of our challenges that we're facing are coming from our lived experience. And these women in this text called this like living the theories of our flesh, right? So all of a sudden, all of these ideas that are, you know, about law and policy that can kind of seem out here are all of a sudden right front and center for so many of our communities. And so I live in El Huache. I spend most of my time in Española, and I represent Rio Arriba County, which is a largely rural county. We're fortunate right now to not have the high number of cases, but we are very, we want to be good vecinos and vecinas. We know that our neighboring counties are really suffering, and that really borders, you know, our imaginary lines, and that we're here and we need to be responsive to one another. So for me, I really have seen a lot of the challenges met with like with this great like kind of grandmother knowledge and this gusto from our different, you know, community leaders and representatives. For me in particular, I work in higher ed. So our challenges have really been about, and are starting to show like the systemic inequities between rural students and how they receive and interact with right now online teaching. I know that we have a lot of dedicated faculty and staff, teachers in public ed who are doing their best. But when you literally don't have the infrastructure to be able to support learning, I think I saw a meme and it really kind of represents it in a nutshell, is that, you know, if we're grading right now, we're grading privilege, right? Because not everybody, and the majority of people, the majority of households in Rio Arriba County don't have high-speed internet. And so that is one of the types of systemic problems. Also, I'm just really privileged and grateful to be working in community with so many powerful women's organizations. As the director of equity and diversity, of course, you know, we're considered, we're how do I say, we're definitely thinking about academics, but we're also thinking about the whole student, right? So we have a lot of food scarcity issues. We have a lot of issues thinking about, are people safe right now, right? Just because, you know, we're sheltering in place doesn't mean that everybody feels safe at home. And so working with organizations like Esperanza Shelter, Northern New Mexico Crisis Center, Solace, to make sure that we're thinking about how we create safety nets still at times like this. And so for me, we have had to adapt, put a lot of our services online, but also remembering that we need to reach out in other ways, right? So if that means calling people on landlines, sending letters, going back to some of our more traditional ways of communication, just to even reach out and make sure that women and children are safe right now.
Yeah, thank you. I love that, living the theories of our flesh, or flash, really wonderful. Let's hear from you, Renee. What have you heard and how are you adapting and to these challenges at this time?
Thank you, Sarah, and thank you to my comadres on the call with me today. I'm coming from a perspective of hearing from our community partners, that's our grantee partners at NewMexicoWomen.Org, and our community partners about the ways they're adjusting and shifting to meet the needs of their community, their clients. You know, food security obviously has always been an issue in New Mexico, and now this is exacerbating the situation. And so obviously we know there's a lot of food distribution pickups and supporting families at this time, and partners are providing those avenues to support especially rural communities, delivering food and water and essentials. Good examples of those partners that we have is shout out to Indigenous Lifeways. They're located in Gallup. They started the McKinley Mutual Aid Initiative, and they're actively delivering food, water, wood, and other supplies to Native American households that are most vulnerable in the area. And then we know, food security, this is the quick fix that's happening now, but we're looking at long-term perspectives, and our partners have been actively participating and sharing seeds and distributing seeds. And of course, as Patricia mentioned about the grandmother knowledge, and or even just saying indigenous ways of knowing, this subsistence gardening, farming is kind of bringing us back to our New Mexico land-based roots. One example of one of our grantee partners is La Semilla Food Center. They're located in Anthony, New Mexico. They were supposed to be starting now their youth programming and on the farm, and because of the shelter in place or stay-at-home order, instead they're delivering irrigation kits, soil, and seeds to youth and families to have them grow food at home. And similarly, we have a partner, Flowering Tree Permaculture Institute. They're located in Santa Clara, Pueblo. They're utilizing corn from last year's harvest and preparing packages to deliver each week to some of the senior citizens so that they have access to atole, dried pozole, mat flour, and some local honey. Also planning to make seed packs as well to have people start planting at home. I know we had talked about earlier the gender-based violence, the fact that that's an issue, and now that we have a stay-at-home order, it means that women and men experiencing domestic violence, they've had to stay inside at home with their abusers, and often weighing the consequences of seeking help and potentially being exposed to COVID-19. But the other option is potentially being experiencing violence if they stay in their homes. So we want to give a shout out to our partners at the Otero Lincoln County Sexual Assault and Nurse Examiner Program that's located in Alamogordo. They're still providing a full range of sexual assault and domestic violence services, and their nurses are being proactive, obviously using masks, offering masks to their patients, but they're really trying to figure out, as probably other sexual assault providers in New Mexico, how to do outreach to make sure that people are aware that they still have services and they still can access their services. So that's an important piece, although we're not seeing it in Santa Fe, the numbers are increasing, but we are seeing it, that we know it's happening. Also, there's an organization called Strengthening Nations. They're located in Gallup, New Mexico. They've been raising money to provide safe shelters and hotel rooms for women experiencing gender-based violence. So those are examples. I have other examples, Sarah. I mean, I could keep going on. We have immigrant communities. I'm just looking at you nodding, saying it's okay, moving forward. Okay, so in terms of immigrant communities, we've heard from our partners, obviously immigrant communities are not getting the stimulus. They don't qualify for the stimulus funds. They have been living in fear, and ICE is still active in some aspects. We did give a shout out to Encuentro, located in Albuquerque, and their instructors and staff have been mobilizing quickly and creating similar to like a calling tree system where they personally call each of their over 300 students each week to provide information and resources. They're offering companionship in that way, verbally and on the phone, and accessing and really assessing like what it's looking like for family stability, because many of these families are undocumented or they have mixed documentation status, and they're in crisis like a lot of us. And so they've also established a COVID-19 Immigrant Family Fund for the immigrant community. And then just, rural community adaptation in general. There's, ways people are isolated because of transportation limitations. And so one of our partners in Doña Ana County, Las Cruces specifically, Empowerment Congress is a nonprofit. They're similarly checking in with their community partners through like a phone tree system. So there's that aspect about communication we're all adapting to. There's reproductive and healthcare access, adaptability adaptation that's occurring. Breath of My Heart Birthplace that's located in Española is providing increased newborn care because a lot of the primary care systems are less accessible right now. So they are allowing their midwives, they're doing more screening that they otherwise would be doing at hospitals, specifically with their screening for newborns. And so one other shout out that I want to acknowledge is that, because of the tremendous shifts in how we're communicating, agencies such as our community partner, New Mexico Office of African American Affairs, they're communicating via e-blasts. They have daily e-blasts that update on resources, information specific to the Black community. They provide the updates of COVID numbers and positive test cases. And they also started a weekly podcast called Living While Black, COVID-19, where they discuss issues African Americans in New Mexico are facing while navigating through the COVID pandemic. And I'll stop there. We have many other examples of applications and doing really great work in New Mexico in the nonprofit sector. Thank you.
Wow, what a great comprehensive list, Renee. Thank you for sharing that. It really does lay bare those who have access to capital and funding, those who don't, and why, and those that privilege, and also those systems that are set up to support certain communities and not support other communities. So it really does point to the need for emergency funds to invest in communities and fill those gaps where folks don't have access as readily as other communities do. So thank you for sharing that. And welcome to Sarah Silva from Las Cruces calling in today. We're glad you're here and that you made it. That COVID-19 did not produce the inequities we're seeing and hearing about. COVID-19 is just amplifying and revealing them in very, very specific and technical ways. And so we want to get into that a little bit. I'm going to go to you, Fatima, and ask you to explain and speak to how COVID-19 is revealing those inequities, and particularly how it's impacting self-identified women and women and girls of color in New Mexico.
Thank you, Sarah. It's so great to be on here with you all this morning. So as you said, COVID-19 is definitely not the beginning of these inequities, but its effects certainly exacerbate the existing inequalities. So in 2017, our Heart of Gender Justice research that we did found kind of almost a lot of predictors to what we're seeing, how unequal the impacts of the current pandemic are. So for example, in that research, we found that Native American women were more than twice as likely to be poor than their peer white women, who are already at a disadvantage to white men. We also saw that race and ethnicity were really closely linked to having access to insurance coverage and healthcare services. And again, this disproportionately impacts Native American women, but also impacts Hispanic and African American women. And so then when we see the health disparities occurring now in terms of how COVID-19 is impacting communities, we sort of knew this was going to be the case. These inequities were already there and already unacceptable for a long time before this. And similarly, we see, for example, for single women in that same research project, we found that women-headed households with children under the age of 6 were over 4 times more likely to be poor than 2-parent homes. So in COVID-19, what this really looks like is, women who were already struggling economically are now really being pushed to the brink. And then kind of beyond that, it's so important to just emphasize who our essential workers actually are. And so to be very clear, women of color are more likely than any other population to be doing essential jobs than anyone else, whether that's cashiers, home healthcare aides, emergency room nurses. Women are at the front line of this crisis, and particularly women of color. And then what's really essential to talk about is that these jobs have been very undervalued and underpaid for so long. So this is an unseen labor force that keeps our country running and takes care of people in need, whether or not there's a pandemic. And now it's being exacerbated because women are overly exposed and bearing the brunt of this without sufficient pay. And then a few other ways are, caregiving roles. We know that as the formal economy has shut down, in fact, most women, and particularly women of color, are working even more, in these kind of unseen, undervalued, and uncompensated caregiving roles. And we know that caregiving, whether of children, elders, the sick, it's essential for economic production to take place, but it's split off from the formal economy and it's unpaid. So we see that women, and again, particularly women of color, are working even harder during this crisis. And that's really because of these pre-existing inequalities. And then there are just other dynamics. We know particularly the trans community and trans women of color who were already being marginalized far before this crisis. Now this is just exacerbated. For example, our partners at the Transgender Resource Center have been really telling us about how trans women of color in Albuquerque who are experiencing homelessness now have no access to bathrooms for hygiene, to do kind of any kind of hygiene to prevent COVID-19. So we're seeing exacerbation. Similarly, in the Asian American community, we already were there already was structural racism, and now with this pandemic, we're seeing a lot of xenophobia towards Asian Americans. And then just a final point is really about young women. And we know that how, as Patricia mentioned, this crisis, the way it's impacting rural communities and low-income communities it looks different. So we know, for example, that schools in rural and low-income communities have less resources. Folks don't have access to high-speed internet or may not have a quiet place to work within their homes. So then we know that the educational outcomes will be even further entrenched for communities of color, low income, and rural communities. So some of our partners, for example, Girls Inc. of Santa Fe, are doing outreach to girls and young women in the community to do check-ins and try to really provide that mental health support. And then other partners, for example, the Counseling Center, which works with young women in the Mescalero Apache Nation, they're trying to kind of continue their programming, but it's very challenging with how communities are really having to shelter in place and stay at home. So those are just a few of the different ways that we're really seeing that these pre-existing inequalities are being further exacerbated by COVID-19, particularly for women and women of color. Thanks, Sarah.
Thank you so much, Fatima. Love to hear from you, Sarah, to weigh in on that piece around how structural inequities are being revealed and made more explicit by this crisis.
Yeah, thanks for having me on. Sorry, I jumped on a little bit late. I think Fatima just named all the really significant aspects on how self-identified women, girls, and women and girls of color are being impacted by this pandemic. And I'm a mom. I have 2 girls here at home, and they're also experiencing this in all sorts of ways as an elementary school student and as a middle schooler. So the relationships that are being just separated, like kids not having community, and the impact that has on mental health is a big issue. And I'm also really curious about how our current women and the leadership that self-identified women and girls have already brought to New Mexico are even further exemplifying the power building and leadership that women can bring to times of crisis. So if you look at many of the mutual aid efforts happening across the state, many of them are women-led. And for better, for worse, our leadership and our leaders, our problem solvers, and our healers are going to help us get through this pandemic. And so I think, encourage our state legislatures and local governments to really trust the wisdom and leadership of women in this time, because that's what's getting many of our communities through right now.
Hear, hear. Wonderfully well put. We need the women leadership and the feminine ways of leading to get us out of something that was created by a patriarchal way of leading. Love to hear from you, Jamie, on this question of structural inequities and what you're saying.
Thank you. Yeah, I would just echo everything that everybody else said. Whether it's poverty, gentrification, the food deserts, access to healthcare, environmental racism, systemic racism, and then we just observed, missing and murdered Indigenous women and girls and relatives day a couple days ago. And how does that relate to the rise in domestic violence cases and the racism that's occurring in border towns right now and the harm that's being done? Access to the internet, definitely. We are seeing this in the census right now. The census has actually put on hold their count in tribal communities and in some rural communities throughout New Mexico, which account for 20% of our population. So that could have huge effects for the next 10 years in federal allocation of funding, because the census just cannot go in tribal communities, and a lot of tribal communities don't have access to the internet to respond. Access to water and wealth. I had read somewhere that women of color, we don't have data on Native American women, but like women of color don't have wealth. So it ranges from $100 to $200. So what does that mean when a pandemic hits? There's no economic security or safety net. And one more thing is student loan debt. Women hold about 2/3 of the student loan debt in the US. So what does that mean, So yeah, it's exacerbating all of that. It's showing the critical gaps that exist. And I think just as women and women of color, our key roles is not only economic stabilizers and family stabilizers, but then to the other point, we are also caregivers, and that's unpaid work. So yeah, and I also wanted to mention that Roan Horse Consulting actually mapped grassroots organizations, funders, things that are happening on the ground. So that's on our website, really just to help with supporting resources and communities connect to resources and highlighting all the grassroots work that's being done. And a lot of it is women-led.
Excellent. And would you just give a brief summary about Roan Horse Consulting and what you all do and your mission?
Sure. So we're an Indigenous-led, Native women-owned business. We support communities. We center communities of color. We do a lot of it from our Indigenous ways of knowing and our Indigenous perspective, with equity at the center.
Thank you so much for the powerful work. And Patricia, I would love to have you address this question as well, so we can hear from everyone.
Keep forgetting to unmute myself, which is so rare. I really want to amplify so much of what everybody's already said. One of the things that I prepared is thinking about, how women are the primary caregivers in so many of their families, and that's leadership that's not traditionally seen, right? And so there's this message that keeps going out in the national narrative, which is that, everybody's out of work, there's no work. Well, no, it's everybody's doing the kind of work women have been doing traditionally, right? Work in the home, work with children, work to take care of their community and take care of other members of their family. It's just that kind of work has never been valued in a patriarchal economic system. And so for me, the structural inequities that are being laid bare really have to do with feminist economy, right? Like, how do we, beyond this COVID moment, think about how women-centered thinking about finances and wealth needs to be a bigger part of the conversation. Thinking about, I have to amplify that women are the majority of teachers, but men are still the majority of administrators, not just in the state, but across the country, right? And so when we're talking about who's making decisions about allocations of budget and how money should be spent, in education systems, and I'm sure in other systems as well, there's this sense that women are not at that table. And so for me, I really hope that, as Sarah was saying, that we can take this spirit of seeing so many wonderful nonprofit organizations, a lot of foundation work, but also in my community, I'm so proud to see women stepping up. Like, there's Brenda Romero, who's the director of the hospital, who has really created really fair and accessible ways to be tested for the COVID-19 virus. She's done a great job of coordinating with a lot of the rural health clinics to make sure that we're using mobile clinics to make sure that the smaller communities are also getting access to healthcare. It's really imperfect, but it's also a model for, from what I understand, for other parts of the country. We have women who are coming together with some of their traditional knowledge, right? Like the sewers, there's Rosie the respirators that have come out of Rio Arriba, but I know that there are several other kinds of those coalitions of people getting together and sharing that knowledge, that traditional knowledge. But I really also want to talk about, in terms of structural inequities, right now, how racism is rearing its ugly face. Not that it's not always an underlying issue in our communities, but I just really want to let people know, if you have not heard about some of the horrible things that are happening. The UNM Africana Studies program has been receiving, and their, in particular, faculty members have been receiving a lot of racist and racialized messages. And just even this concept of like armed terrorists storming state capitals, ours included, and calling themselves protesters and activists. And as somebody who identifies as an activist educator who is schooled in grassroots movements, I find it really offensive that people are co-opting our movements and our messages to basically give this counter message, right? I saw a term that this is called astroturfing. It's basically when people do this faux grassroots movement, and we need to be able to language it, right? To me, it's really troubling when I see women holding up signs that say, keep your laws off our body. And they're talking about having access to getting, you know, their nails done and their hair done, as opposed to like the decades long, centuries long struggles for women to have reproductive justice and access to things like abortion and reproductive justice healthcare. And so for me, there's just this sense that that's something that we have to think about. I was reading an article earlier this week that was speaking about, you know, a lot of times people speculate, you know, like, who would I be if slavery was a system in place in 2020? And the example that they gave is like, for people are not who are these on the Capitol right now, they're not going out protesting saying, let me do nails, let me cut hair. What they're insisting on is that workers be available to service them, right? So there's this sense that we know how some people would respond to slavery, because they still have a sense about how laborers and workers are supposed to exist to serve them in this privileged way. And so I think we really need to interrupt that. We really need to start digging deep. One of the things that is happening right now that's exciting is that there's a lot of access to public education, right, and to public conversations. I would really recommend Kimberly Crenshaw's webinar that she's hosting weekly from the African American Policy Forum and Intersectionality Matters. They've been doing it for 5 weeks now, but it really gives a strong sense and gives us the background to understand beyond like the time we have now in an hour to go deep into some of these subjects. And so for me, that is one of the ways I think that we can do some work to help us, you know, uncover these systemic issues that so many of us have already been working on. And I'll just end by quoting one of my former professors, Dr. Malia Powell, and just to get us to think about how, in the greater schema of the history of this nation, New Mexico has always been considered a national zone of sacrifice, right? There's this sense that, you know, you can send your nuclear waste here, you can send your nuclear bombs here, and that we're supposed to just take that as a people. And Dr. Powell says, we live in a country that's designated too many people as part of its sacrifice population in order to maintain entitlements. And I think that as feminist leaders, we really need to take this moment, like in this moment and beyond, to question, like, why do we even consider anybody a sacrifice population, you know, especially the most vulnerable? And so it just really is in concert with what all of my sisters are saying here today.
Wonderful. Thank you for that, Patricia. And it segues beautifully into this next question we want to ask the panel, and also what you were referring to earlier about what we talk about theoretically is here. We are living it. This is about our lived experience in the moment. And also for those of us who have been working for social justice and social change, now is the moment for those visions, for those dreams, for that work to be lived into and to be actually implemented, and not just in a theoretical space. So we talk about it in NewMexicoWomen.Org. It's like the future we were looking to is with us right now. We are facing the future. We're in the future. And what does this pandemic offer in terms of an opportunity for that feminist economy to come to life and to really take hold, and for all the different ways our movements have been working? What opportunity is in front of us as a result of this pandemic? And we'd love to hear about those visions. And I'd love to start with you, Jamie, to hear from you.
Thank you. Yeah, it's like the future was always just kind of like something you would look at. Now it's here and it's like real and urgent and quite frankly, a matter of life and death at this point for a lot of people. So I think there's a number of opportunities. One, it's centering women, women of color, definitely looking at design and equity work. I've seen where cities, counties that have taken that approach, that lens, have definitely responded to those most vulnerable in their communities. And then with respect to like philanthropy, right? Like making access to funding easier, funding the people, prioritize people that are on the ground, that are doing the heavy work right here and right now. And then with respect to the work that we do with businesses, like a lot of the CARE money, we haven't seen really trickle to Native-owned businesses or people of color, women of color. We haven't even seen any of the tribal money that was appropriated for tribes. So it's been like a whole month now. So yeah, there's so much work, I think, on the policy level. I think there's so much opportunity to like push, universal health care, wage equity, because that's a huge inequity that exists right now. Housing, access to housing and affordability, access to the internet, increasing that. So there's so many things that I think that we can mobilize and rally around. And I just also want to say, like, that's also our call, and in addition to all the other work that we're already not getting paid for.
Thank you. And how about you, Sarah? Can you weigh in on that?
Yeah, of course. So my background is in community organizing, and I think I'd want us to look at three things: belonging, survival, and healing. And that over the last 2 months, but also the next 2 months and the 2 months after that, people are going to be reinventing the definition of who belongs, who gets to survive, and then who's responsible for and how we heal together. So healing is inextricably linked to building power. So that is an element that I don't want us to forget here, is that how are we healing ourselves and one another when that time comes for us to be ready to heal. And then I think I'd invite other people, those of us who are organizers, activists, movement builders, is what are the bold, small experiments that we can try on, and that really right now we need all the ideas, all the boldness and the risk taking that our communities can have right now. So if you think, oh, who am I to try and do this thing? Do it. Don't wait for permission, because these are bold, small experiments. When you plan them well and have perseverance, they will actually produce power and solutions for our communities. Mm-hmm. So I'd leave people with questions like, what can you help build right now? And what conversations can you start to increase the safety of your community? So what can you build now? That's what I'd leave us with. And adelante. And I'm really glad to be building power and support with so many powerful women and communities across the state.
Yeah, the bold, small experiments is just a really powerful invitation to what probably is already happening and was happening before this, but now we're putting more of an emphasis on it. And it's really the time to put those things forward and move them and move them in concert with other bold, small experiments. I mean, I just think of the mutual aid efforts you've been involved in so closely in Las Cruces and that are happening all over the state and the country, and how bold they are and effective they are. And of course, as you said earlier, being led by women mostly. Fatima, I'd love to hear too some of the visions that you're holding and recommendations you're holding for the audience in terms of moving beyond the COVID pandemic.
I think in the conversations that Renee and our staff at NewMexicoWomen.Org that we've been having with our grantee partners across the state, just to really echo what Jamie said, is just recovery plans should really just center women, and especially working women of color. And this isn't like an exercise in, oh, this would be nice to have them in the room. This is essential for survival. And really, because we're seeing how gendered the impacts are because of pre-existing inequalities, with gender-based violence increasing, and the impacts on rural maternal health care and women in essential essential work roles. So we really need to center women and women of color in our recovery plans. And then looking out, as Jamie said, at these policies, these deeper policies like living wages, and paid family leave, universal health care, and as from a funding perspective, funding community organizing and advocacy to work for those things, and funding that now and funding that in the long term. And just to say, we're standing at a juncture now, and when we think about futurity, or how we collectively imagine the future, that's always political. How we represent the future is always politicized. And we saw that under slavery and under Jim Crow, that this future isn't possible until it's possible and we make it possible. And when we study the future, we know that multiple possibles are always opened or closed by our actions right now. So as Sarah was saying, what's the bold, experiment we can try now? And we're in this particular moment where, as a result of this very profound crisis, we can imagine and build a different future. And that has to be really deeply rooted in racial, economic, and gender justice.
Here, here. Renee, I'd love for you to add to that.
Well, I think you all said what I was thinking about, the way we envision how we want to see the future, or how we are in the future. I was just thinking from a funder perspective, since NewMexicoWomen.Org is a funder, a women's fund, and to think about this as, philanthropy in general. Fatima did say we need to continue supporting and investing women of color and organizing and advocacy in our state, especially as it relates to securing ways to support living wage, paid family leave, the universal health care that we just talked about. I also want to think about how we do grant making in general is important, about really not creating more barriers for nonprofits, not just to apply for emergency grants, but in general, thinking about how we can do better, like not creating tedious reporting requirements, and really acknowledging that community partners are, they are the experts and they have the lived experience, so they know it's best in a way so that they can tackle these community issues or experiences that we have. So I just want to make sure that we always defer to our community partners as the experts.
Yes, exactly. And also making sure there are participatory practices when it comes to dispersing resources, and that gatekeeping by folks in positions of power need to move over and make sure that communities have access to the resources they need, and make decisions and have agency over those resources. Patricia, I'd love for you to speak to this question as well.
Sure. And I just want to say I'm so excited to be around and surrounded by such brilliant, powerful women. And I'm in awe of what everybody is saying today. And I'm like, yes, I'm on board. And I really want to just amplify also something that I've learned from Kathy Sanchez and Corinne Sanchez at Tewa Women United, the idea of, like how Fatima is saying, futurisms, right? That part of one of our most powerful resources is our imagination, is being able to imagine things being different. And so Kathy Sanchez always speaks to us about a culture of peace and how do we cultivate that, right? And so it's out, like, as we go through this COVID moment, it's like just been so shocking to me that where we land up is literally in this false binarism between health and economy, right? Like there has to be a way, when we put our best imaginations to work, that we can have both of those things at the same time, right? The fact that people are holding up signs that, say, that my money is more important than your life, to me is unfathomable. And I want to fathom a different future where people don't have to feel attacked, right? I think a lot of this and a lot of the response has been falling again, like along partisan lines. And to me, I want to imagine a future for all self-identified girls and women, regardless of what your political affiliation is, where we can be healthy and safe and have access to healthcare, and that we don't literally have to put people in piles of haves and have-nots. And this brings me back to like the concept of philanthropy. I come from a community that is often maligned, and it always reminds me that I would think, like, people tend to also think in the false binarism of the funders and the funded, right? That, like, somehow you're either one or the other. And in Rio Arriba, it's not that we don't have resources. We're bountiful in resources. It's that our resources are extracted to make other communities work. So an example of that is over 90% of the fresh produce for my community goes to make other communities work, right? Wealthier communities that have that level of access. And so we need to also interrupt this poor but happy narrative around philanthropy, this idea that we need to also call into question about how poor people do not exist so that people can experience gratitude for their excess, right? And so it's like turning this on their head, turning idea of giving on its head from charity to solidarity, that our work is bound to each other, and that if we are in the position to have wealth, that we need to share that, because it's not about just helping people. It's about understanding that your liberation is tied up with other people's liberation, and that the true dismantling of these systems comes when we recognize that humanity in each other.
Yes, and this definitely has to be reframed, especially within philanthropy when we have that charity mentality. And I know that Co-Capital is working on some of this too, Jamie, and I'd love for you to share a little bit about that.
Yeah, thank you. I appreciate that. I think to the point of like, we need examples, you know, our mission is to revolutionize systems and inspire innovation. So I feel like we're definitely here in this future space. We partnered with Nusenda Credit Union in a really interesting way to co-design what a loan fund would look like that actually challenges all the traditional underwriting criteria that banks do, which is like all the 5 C's of credit, capital, collateral, which a lot of our communities don't have access to. So what we're doing is we're recognizing that Native women are like the backbones of our communities. They're the financial stabilizers. Therefore, we're not going to require all of those things. And, you know, we are just going to trust and give them money that they need for what they deserve. So a lot of what the funds will be used for is just to survive, for housing, business rent, utilities, food, a pivot plan, and then the interest rate is 0%. Like, we feel that's very equitable with a grace period. And we're actually working on really trying to figure out like, how do we support those payments long term. But that's one example of how you can really transform systems and challenge current structures and inequities with community at the center and community co-designing it.
Yeah, that's really, really creative and beautiful. And I know we have one question coming in, if someone wants to respond, about how this is particularly impacting folks with disabilities and who are immunocompromised. Does somebody have, can somebody speak to that? Because it's a particular kind of impact on the communities.
Yeah, I think I have one daughter who's immunocompromised, and I have an autoimmune disease myself, and trying to figure out how, one is who is expendable in the economy. So we've named that again. And then also asking for the wisdom and leadership of the activists and organizers in the community that has dealt with disabilities and chronic illness. And they've been doing so much work on accessibility that now all of us have been trying and fumbling to figure out, how do we do interpretation online? How do we make sure everything is, even where we have text for all of our images, this community knows how to do it, right? And rather than us trying to guess, it's really important to ask for the wisdom that already exists from communities that have been asking those of us who are able-bodied to and neuronormative, let us in, help us find access and be as participatory as possible. So live streaming our city council meetings, our legislator committee, all of those things are super important. And they're going to be important after this. So I think looking at that, and then also just access to healthcare time and time again, and pre-existing conditions, and making sure that people who have pre-existing conditions remain protected and covered in this time. So really, how are we expanding Medicaid for everyone at this time? Those kinds of things are really, really vital.
Yes.
Thank you for that question.
Yes. I'm looking at the time. Does anyone else want to respond to that question?
Yeah, just one more really quickly. This is Patricia. Is just also saying that all of a sudden a lot of the work that we do is being invited to the table, right? I found it very interesting in these last few weeks that all of a sudden, those of us who have been talking about like marginalized communities, vulnerability, are being invited when everybody is vulnerable. And so what I would ask us to think about beyond this point is that we should always be part of the conversation. We should always be at the table. Right now, like our accessibility services coordinator at the college, right, is doing that great job of being at all these different meetings to help make sure that we are meeting the needs of our students who are differently abled. But for me, it's like that should happen all the time. And so for me, like that's one of those opportunities as well as we go into the future. So I'm also really proud that at Northern, we've had a weekly meeting since this all started about how we serve marginalized and vulnerable students. And for me, that's something I hope that persists from this moment forward so that we're always having that conversation.
Yes, hear, hear. So I'm looking at the time and I just want to thank you all. If folks out in the audience have other questions for any of our panelists, you can find us at NewMexicoWomen.Org, at NativeWomenLead.org. We can get questions out to anyone because we're going to have to wrap up. We definitely want you to consider giving a gift to the Gender Equity Emergency Fund at NewMexicoWomen.Org and also to the Matriarchal Response Loan Fund at Native Women Lead, because we know that our requests have outstripped our capacity to meet the needs. And so we need to keep filling those funds so we can get that out to communities. And just in closing, we need to see, we need to trust, and we need to acknowledge self-identifying women's leadership and our capacity to heal in this time. And we know that you all support that and that you're all behind that. And we thank you all the women leaders in the state, all the women on this powerful panel and beyond. We appreciate your work. We see you, and we cannot get through this pandemic without you. And so here's to that. Thank you for joining us.
Thank you, everyone.
Thank you.
Yeah. Bye, ladies.
Bye-bye.